All right, everyone, get ready for a deep dive you asked for. We're going deep into thoracic trauma.
Oh, buckle up.
You sent over medical textbooks, case studies, so we're not messing around. We're going beyond the basics here.
Absolutely.
And you know what's really got my attention? Thoracic trauma. It's on the rise.
It is.
And not just for the reasons you might think.
Yeah.
Of course, car accidents, always a factor. But we're also seeing an increase because of rising crime rates.
That's right.
Which means in these situations, those first few minutes, absolutely crucial.
Yeah, quick, accurate assessment, really key for paramedics. Got to figure out what's really going on and then prioritize.
Life-saving treatment.
Absolutely, life-saving treatment.
So before we jump into the drama of the cases you sent, let's make sure we're all starting from the same place.
Okay.
Thoracic trauma, when we say that, what are we really talking about?
So thoracic trauma is any injury to the chest cavity,
Okay.
the space that holds, well, some of our most vital organs,
Right.
your heart, lungs, major blood vessels. And you can imagine when those structures get injured, things can get serious pretty fast.
Yeah, no kidding. So any injury to that area, whether it's like a heart impact or something penetrating the chest,
Exactly.
makes sense why this is such a critical area to understand.
Yeah.
Now, you sent over 2 case studies.
Yes.
Let's jump right into the first one.
Okay.
This one involves a 28-year-old female skier.
Okay.
She had a pretty rough fall while trying to ride the rail at Drayton Valley Ski Hill.
Ouch. Riding the rail, those wipeouts can be brutal.
Yeah.
So what did the initial assessment show when the paramedics got to her?
Well, first of all, conscious and alert, always a good sign.
Yeah, for sure.
But she was definitely in a lot of pain.
Okay.
And because of that, breathing shallowly.
Right.
They got a strong radial pulse, no external bleeding,
Hmm.
but they suspected some fractured ribs.
So far, so good. But shallow breathing after a fall like that definitely raises some concerns.
Right. Her pain assessment said it was sharp, sudden onset, located in her left lateral ribs, 5, 6, and 7.
Okay.
And had been going on for about 25 minutes.
Yeah.
Her vitals, mostly stable. Blood pressure was good. Heart rate, a bit elevated. Respiration's normal, considering, she's in pain. And oxygen saturation was 99%.
Okay, so on the surface might seem okay, but that elevated heart rate could be from more than just pain or anxiety. It could
Right.
be a sign of internal bleeding. Might not be obvious right away.
So even though her breathing seems okay now, you're saying that could still become a problem later.
Exactly. Think about it. She's got potential rib fractures, breathing shallowly because of pain. So what happens if those fractures start affecting her lung function?
Okay.
That's why they would be watching her very carefully, even if things seem stable at first.
Right, right. So what kind of treatment did they start at the scene?
Standard C-spine support, protect her spine, just in case. Gave her pain medication, some oxygen, started an IV. And the report also mentions that they were monitoring for something called paradoxical movement of the chest.
Paradoxical movement.
Yeah.
That sounds ominous.
Yeah, so paradoxical movement, that's a telltale sign of a flail chest.
Okay.
And that is a serious condition that can happen with rib fractures.
Right.
Imagine this. 3 or more ribs next to each other, each broken in at least 2 places. Basically, a section of the chest wall detaches. And it starts moving in the opposite direction from the rest of the chest when the person breathes.
Wait, so as they inhale, that section sucks inward, and then as they exhale, it bulges out.
You got it.
That sounds like it would make breathing incredibly difficult.
It does. That's why paradoxical movement is such a red flag. It can lead to major problems with breathing and oxygen getting to the lungs. And here's the tricky part. Sometimes it doesn't show up right away.
Why wouldn't it be obvious immediately? You'd think a detached section of the chest wall, that'd be pretty noticeable.
You'd think so, but those intercostal muscles, the ones between the ribs, they can initially act like a splint, holding things together, so it kind of masks the problem.
So it's like a hidden danger.
Yeah.
You might not realize how serious it is until later.
Precisely.
Right.
It's one of the reasons why thoracic trauma cases require such close monitoring, even if things seem okay initially.
Okay.
Now, this case study didn't give us details on her hospital treatment, but they would definitely continue to monitor her breathing closely, manage her pain, and probably do imaging to confirm the rib fractures and check for any other injuries.
Okay, so skier number 1, definitely in a precarious situation. And it's interesting, the second case study you sent highlights how different these presentations can be. This time, it's a 36-year-old woman named Natalie, and she's experiencing worsening chest pain several days after a car accident.
Delayed presentation's always a bit tricky. It's easy to brush off lingering pain after an accident, but sometimes it's the body's way of saying, hey, something's not right here.
Right. Exactly. So what was going on with Natalie when the paramedics arrived?
She was conscious and alert, breathing a bit shallowly like the skier.
Okay.
Good radial pulses, no external bleeding. But here's a key difference. She was complaining of substernal pressure.
Substernal pressure. Doesn't that usually point to a heart problem? I mean, isn't that one of the classic signs?
You're absolutely right. While rib fractures can definitely cause chest pain, that feeling of tightness or squeezing under the breastbone, that's a huge red flag for potential cardiac issues.
So we've got this delayed onset of chest pain.
Uh-huh.
And it's not just any chest pain, it's substernal pressure. What else did they find out about her pain?
Well, it had been a constant ache throughout the morning, an 8 out of 10 on the pain scale, which is pretty significant. And here's another concerning detail. She had been taking Tylenol, #2, which has a mild narcotic, and Toradol and NSAID, but neither was providing any relief.
That's definitely not a good sign.
No.
It's like her body is screaming that something is wrong, but the usual pain relievers aren't touching it.
Right.
So what does that tell us?
It suggests the pain might be more than just musculoskeletal soreness from the accident. It could be coming from the rib fractures themselves, or, and this is the worrisome part, it could be related to a cardiac issue.
Especially with that substernal pressure.
Exactly. That's why they wouldn't just chalk it up to sore muscles. They would need to dig deeper and rule out any heart involvement.
And that's where those test your knowledge questions from the textbook come in, right?
Yes.
The ones about differentiating cardiac contusion from commotio cordis.
Exactly. Those questions are perfect for this scenario. They really make you think about the subtleties of these conditions. So let's break them down.
Yeah.
First up, cardiac contusion.
If I remember correctly, a cardiac contusion is basically a bruise to the heart muscle, right?
You nailed it. It's often caused by a blunt force to the chest, like in a car accident. And just like a bruise anywhere else, it can cause pain and swelling. But when it's the heart, it can mess with the electrical signals that control your heartbeat.
Right.
We're talking potentially dangerous arrhythmias.
Okay, so that's cardiac contusion. And then there's commotio cordis, which, if I'm not mistaken, is sudden cardiac arrest triggered by a blow to the chest at a very specific moment in the heart's electrical cycle.
Wow, you really did your homework.
Well,
It's less common than contusion, but often more deadly.
okay.
Especially in younger athletes.
Right.
Where a seemingly harmless hit can have devastating consequences.
And how do they figure out which one it is? They both seem like they'd cause serious heart problems.
That's where an EKG comes in.
Okay.
A cardiac contusion might show up as abnormalities in the heart's electrical activity on the EKG,
Okay.
whereas commotio cordis might not, at least not initially. It's a really nuanced diagnosis.
Wow. Okay, so with Natalie, we've got delayed chest pain, substernal pressure, and pain that's not responding to medication. Then you add in the possibility of a cardiac issue like a contusion, or even worse, commotio cordis. Suddenly those test your knowledge questions aren't just theoretical anymore.
You're catching on quickly, and this is just the beginning of Natalie's story. There's so much more to unpack in her case, and I can't wait to dive into it further and see what the paramedics uncovered.
We left off with Natalie in this really unsettling picture. Delayed chest pain, substernal pressure, and the pain meds, not even touching it.
Right.
I'm on the edge of my seat here. What happened next?
Well, given the red flags, they rushed her to the hospital.
Okay.
But first, the paramedics, they gathered as much information as they could. They found her blood pressure was slightly elevated, but her heart rate was normal, which seems a little odd considering the amount of pain she was in.
Right. You'd think with an 8 out of 10 pain level, her heart rate would be through the roof. Does that mean we can rule out a heart problem?
Not so fast. Remember, this is a delayed presentation.
Right.
Her body's initial stress response might have calmed down, but that doesn't mean the underlying problem has gone away.
Okay.
And we can't ignore that substernal pressure.
Right.
Plus, her respirations were a bit shallow, 18 breaths per minute, and although her oxygen saturation was holding steady at 99%, the shallow breathing's still a concern.
So lots of things pointing to something more serious going on.
Yeah.
What happened once she got to the hospital?
Okay, at the hospital, they would run a battery of tests
Right.
to get a clearer picture. An EKG would be top priority to check for any irregular heart rhythms, and they'd likely order a chest x-ray to assess the rib fractures, look for any other issues.
Like fluid in the chest cavity.
Exactly, like fluid or air in the chest cavity.
The textbook actually mentions pulmonary contusion as a possible complication with rib fractures, especially after a big impact. Basically, it's a bruise to the lung tissue itself.
You're absolutely right. And that's why getting a quick diagnosis and treatment is so important with these kinds of injuries.
Right.
A pulmonary contusion can make it hard for the lungs to do their job, getting oxygen in and carbon dioxide out. Plus, it can increase the risk of infections.
Definitely not something you want to mess around with. Okay, so we've got these two cases, both involving potential rib fractures. But with such different presentations and potential complications, what are some of the key takeaways we can glean from this so far?
I think the biggest takeaway is that with thoracic trauma, prompt and thorough assessment is absolutely critical.
Okay.
That means checking the ABCs, airway, breathing, and circulation, monitoring those vital signs like a hawk, and doing a really thorough physical exam to catch any obvious injuries or signs of internal bleeding.
And we've also seen how the type of injury, blunt force versus penetrating, can lead to very different types of injuries.
Exactly. But there are commonalities too.
Yeah.
Remember the pain assessment, not just where it hurts and how much, but also the type of pain.
Right.
Sharp, stabbing, aching, and whether it's constant or comes and goes, that can give clues about what's causing the pain.
And those test your knowledge questions really brought home the point that these injuries can be far more complex than they seem on the surface.
Absolutely.
Like with the flail chest, you might not see the paradoxical movement right away.
Right.
And those cardiac conditions can be difficult to diagnose without careful EKG interpretation.
Absolutely. It's not just about memorizing facts. It's about connecting the dots, thinking critically, and being aware of the subtleties.
Okay, I have a question that's been bugging me. In both of these cases, the patients were conscious and alert when the paramedics got there.
Right.
But what happens if someone with thoracic trauma is unconscious? Does that change the approach entirely?
That's a great question, and it definitely raises the stakes.
Yeah.
An unconscious patient can't tell us what they're feeling or where it hurts.
Right.
So we have to rely even more on our assessment skills and look for clues.
So things like checking their pupils, looking for signs of trauma, and of course, constantly monitoring those vital signs.
You got it. And time is of the essence in those situations.
Yeah.
We need to stabilize the patient, make sure their airway is clear, support their breathing, and control any bleeding while trying to figure out what's happening internally.
That sounds incredibly intense. It really highlights the importance of quick thinking and expertise in those first responders.
Absolutely. They're often making life or death decisions based on limited information. And it's amazing how they can piece together the puzzle under such pressure. Now, while we're talking about procedures, the textbook mentioned chest tubes.
Okay.
I know they're used in thoracic trauma, but I'm not entirely sure why.
I'm with you. Chest tubes always sounded kind of scary to me.
They might sound scary, but trust me, in the right situation, a chest tube can be a real lifesaver. It's basically a hollow tube inserted into the pleural space. That's the area between the lung and the chest wall.
Okay, and what does that accomplish?
It allows any fluid or air that's built up in that space to drain out. This can happen for a bunch of reasons.
Right.
For example, if someone has a collapsed lung, also known as a pneumothorax, air can get trapped and put pressure on the lung, preventing it from expanding properly.
So the chest tube acts like a release valve, letting the air escape and allowing the lung to reinflate.
Exactly. Chest tubes can also be used to drain blood or other fluids that might be collecting in the pleural space, like after surgery or in cases of internal bleeding.
Makes sense. But how do they decide if someone needs a chest tube? Is it based on the type of injury, their symptoms, or something else?
It's usually a combination of things. The type of injury, the patient's symptoms, their vital signs, and what they see on the physical exam and imaging studies.
Okay.
For example, someone with a penetrating chest wound is much more likely to need a chest tube than someone with a simple rib fracture.
So it's not just a standard procedure. They really have to assess the situation and determine if a chest tube is the best course of action.
You got it. And just like any medical procedure, there are risks and benefits to consider.
Right.
But in the right circumstances, a chest tube can truly be a life-saving intervention.
Wow. This deep dive has really opened my eyes to the complexities of thoracic trauma.
Yeah.
I feel like I could ace that test your knowledge quiz now.
I think you could. But the world of medicine is constantly evolving, and there's always something new to learn. Even the most experienced professionals are constantly learning and refining their skills.
That's what makes it so fascinating, right?
Yeah.
There's always more to discover. But for now, I think we've given our listener a really solid foundation in thoracic trauma, and hopefully we've sparked a curiosity to learn even more.
Absolutely. And speaking of learning more, there's one aspect of thoracic trauma we haven't touched on yet, the psychological impact.
Oh, right.
It's often overlooked, but it can be just as significant as the physical injuries.
You're right, I hadn't thought about that. But it makes perfect sense. Going through something as traumatic as a car accident or a violent assault, that can leave some serious emotional scars.
Exactly. And when you combine that with the pain, fear, and uncertainty that often accompany thoracic trauma, it's no surprise that these patients are at a higher risk for developing mental health issues.
So things like anxiety, depression, PTSD, those can all be part of the picture too.
Absolutely. It's not uncommon for survivors of thoracic trauma to experience flashbacks, nightmares, difficulty sleeping, and this heightened sense of danger that can make it hard to relax or feel safe.
Makes sense. If your body has been through that kind of trauma, it's understandable that your mind would be affected too.
Exactly. And here's the thing. Those psychological effects can actually hinder the physical healing process.
You're kidding. So not only do you have to deal with the physical injuries, but the emotional stress can make it even harder for your body to recover.
That's right. Stress and anxiety can increase inflammation, slow down tissue repair, and weaken the immune system, making the body more susceptible to infections and other complications.
Yeah.
It's like a vicious cycle.
So it's not enough just to treat the physical injuries. You have to address the psychological impact as well.
Precisely. That's why a holistic approach to care is so important. It's
Wow.
about treating the whole person, body and mind, and recognizing that healing goes beyond just stitching up wounds or setting broken bones.
That's such an important point. So if someone is dealing with the aftermath of thoracic trauma, what are some of the things they can do to support their mental health?
There are a lot of great resources available, connecting with support groups, talking to a therapist, learning relaxation techniques, and in some cases, even medication can be helpful in managing anxiety or depression.
Okay.
It's about finding what works best for each individual.
It sounds like open communication with your healthcare team is key here.
Absolutely.
They can help you navigate those resources and come up with a plan that addresses both the physical and emotional aspects of recovery.
Exactly. And remember, asking for help is a sign of strength, not weakness. Healing takes time, and it's okay to reach out for support along the way.
That's a really powerful message. We've covered a lot of ground today, from the mechanics of breathing to the nuances of cardiac assessment, and now the psychological impact of these injuries. It's been an incredible journey.
It really has, and I hope our listener is walking away feeling more informed and empowered.
Wow, we've really been on quite a journey today, exploring the world of thoracic trauma.
It has been quite the deep dive.
Yeah, we've talked about flail chests, EKGs, chest tubes, and even those hidden psychological wounds that can linger long after the physical injuries have healed.
Absolutely.
Eye-opening, to say the least.
Yeah, it really highlights the complexity of the human body and how interconnected our physical and mental well-being truly are.
Exactly. And, it's made me think about something. We've been talking a lot about the assessments paramedics do at the scene,
Right.
checking vital signs, looking for external injuries. But what about those internal injuries?
Yeah.
The ones that might not be so obvious? How do they figure out what's going on inside the chest cavity?
Well, that's where those imaging studies we mentioned earlier come in.
Right.
Things like chest x-rays, CT scans, and ultrasounds. Those can give us a peek inside and help us pinpoint the location and extent of internal injuries.
Okay, so a chest x-ray, probably the first line of defense,
Yeah.
quick, relatively inexpensive, and can show things like rib fractures, a collapsed lung, or fluid buildup.
Right, but sometimes we need a more detailed look, and that's where a CT scan comes in.
Okay.
Uses x-rays to create cross-sectional images of the chest, so it gives us this 3D view that can reveal even subtle injuries.
So if they suspect something like a pulmonary contusion, that bruising of the lung tissue, or damage to the heart or major blood vessels, they'd likely go for a CT scan.
Exactly. And in some cases, they might also use ultrasound,
Uh-huh.
especially if they're concerned about bleeding around the heart or in the abdomen. Ultrasound uses sound waves to create images, and it's particularly good at detecting fluid.
So it's like having a toolkit of different imaging techniques they can use depending on the specific situation.
Yeah,
They might start with a chest x-ray and then move on to more advanced imaging if needed.
that's a great way to put it. And the beauty of these imaging studies is they can help us make faster, more informed decisions about treatment.
Right.
For example, if a CT scan shows a large pneumothorax, that collapsed lung we talked about,
Yeah.
they can insert a chest tube right away to reinflate the lung.
It's incredible how technology has advanced to the point where we can literally see inside the body and pinpoint these injuries. Really takes the guesswork out of diagnosis and treatment.
It does. But it's important to remember that technology is only part of the equation.
Right.
It's the skill and expertise of the medical professionals interpreting those images and making treatment decisions that truly make the difference.
Such a good point. It's not just about the machines. It's about the human element, too.
Absolutely.
And speaking of the human element, I can't help but think back to that discussion about the psychological impact of thoracic trauma.
Yeah.
It really stuck with me.
I know, it's something that's often overlooked, but it's so crucial to address.
Yeah.
Those emotional wounds can be just as debilitating as the physical ones,
Right.
and they can have a huge impact on a person's recovery.
And you know, it's interesting. The textbook had a section on pre-hospital care for thoracic trauma.
Yeah.
And it talked about the importance of providing psychological support, even in those early stages.
That's so important. Those first few minutes and hours after a traumatic event can be incredibly overwhelming and disorienting. Just having someone there who can offer reassurance, a listening ear, and some basic emotional support, it can make a world of difference.
And it's not just about comforting words, right? It's about practical things, too, like making sure the patient feels safe and secure, explaining what's happening in a way they can understand, and involving them in decision-making as much as possible.
You've hit the nail on the head.
Yeah.
It's about empowering the patient, giving them a sense of control in a situation where they likely feel very powerless.
And I imagine that kind of early intervention can have a ripple effect, making it more likely that the patient will seek ongoing support and resources as they continue to heal.
Absolutely. It sets the stage for a more holistic approach to recovery,
Right.
where the focus is not just on fixing the physical injuries, but also on addressing the emotional and psychological needs of the patient.
So if we could sum up everything we've learned today in one concise takeaway for our listener, what would it be?
I think the biggest takeaway is that thoracic trauma is far more complex than it might seem at first glance.
Yeah.
It's not just about broken ribs and collapsed lungs. It's about understanding the intricate workings of the human body, recognizing the interconnectedness of physical and emotional well-being, and appreciating the incredible skill and dedication of the medical professionals who care for these patients.
I couldn't agree more. We've delved deep into the science, explored the latest technologies, and even touched on those often overlooked psychological aspects of these injuries. It's been a truly fascinating journey.
And as always, we encourage our listener to continue exploring.
Right.
The world of medicine is constantly evolving, and there's always something new to discover.
That's the beauty of learning, right? It's a never-ending adventure.
It is.
So, to our listener, thank you for joining us on this deep dive into thoracic trauma. We hope you found it informative, engaging, and maybe even a little bit inspiring.
And remember, knowledge is power. The more you understand about your own body and the potential challenges it might face, the better equipped you'll be to navigate those challenges and advocate for your own health and well-being.
Couldn't have said it better myself. Until next time, stay curious, keep learning, and take care of yourselves, body and mind.